Hello everyone, welcome back to the channel. In today's video, we're going to talk about a very important topic, MRI of the foot. MRI, or magnetic resonance imaging, is a modern imaging technique where strong magnets and radio waves are used to create detailed pictures of the inside of our body. It is especially good for showing soft tissues, such as ligaments, tendons, muscles, and nerves, as well as bones and joints. And the best part is, there is no X-ray radiation involved. Why is MRI of the foot done? Doctors usually advise an MRI of the foot when there are different types of problems in the foot, such as long-standing foot pain, swelling or difficulty walking after an injury, suspected ligament or tendon tear, small fractures that are not clearly seen on X-ray, infection in the bone or soft tissue like osteomyelitis, suspected soft tissue or bone tumors, complications in diabetic patients such as ulcers and deep infections. With MRI, we can clearly see not only the bones, but also the joints, cartilage, tendons, ligaments, muscles, nerves, and surrounding soft tissues all together in great detail. How should the patient prepare? Because MRI uses a strong magnet, it is very important to know a few things before the scan. The patient is usually asked if they have any pacemaker or implanted cardiac device, any cochlear implant in the ear, any older metallic implants that may be magnetic, metal plates, rods, or screws from previous surgeries, any metal fragments in the eye or other parts of the body, if the patient is pregnant or might be pregnant. Before going into the MRI room, the patient is usually asked to remove watch, chain, rings, keys, and coins, mobile phone, credit or debit cards, belt, bra with metal hooks, hair clips, and any other metal objects. Sometimes a contrast dye called gadolinium may be used. In that case, the radiology team will ask about kidney function and any history of allergy. How is the patient positioned for an MRI foot? For an MRI foot, the patient is usually lying supine. That means flat on their back on the MRI table. The foot to be examined is carefully positioned inside a special foot coil. Cushions, foam pads, or straps are used to support the foot so that it does not move during the scan. If both feet need to be scanned, then both are positioned inside the coil in a balanced way. The patient is told clearly, during the scan, please keep as still as possible. If you move, the images can become blurry. The MRI machine makes loud knocking and tapping sounds during the scan. If we explain this to the patient beforehand, they stay calm and are less afraid. What structures do we see in an MRI foot? In an MRI foot, we carefully evaluate bones, tarsal bones, metatarsals, and phalanges, joints, ankle joint, subtalar joint, midfoot and forefoot joints, ligaments and tendons, including the Achilles tendon, plantar fascia, and other flexor and extensor tendons, cartilage and joint spaces, muscles and soft tissues, nerves and blood vessels. We look for any signs of tear or rupture, degeneration and wear and tear changes, inflammation or edema, infection or abscess, tumor, or any mass lesion. MRI helps to detect many of these problems at an early stage, sometimes even before they are visible on X-ray. What planes and sequences are used? This part is a bit more technical, but I'll keep it simple. For MRI of the foot, images are usually taken in three main planes: sagittal plane, slices from front to back; coronal plane, slices from side to side; axial plane, slices from bottom to top. In these planes, different sequences like T1, T2, PD, and STIR or other fat-suppressed sequences are used. These sequences help us to separate and identify normal bone and bone marrow, fluid and swelling, inflammation or infection, cartilage damage, and joint changes. If contrast is given, post-contrast images can show areas of inflammation, infection, or tumor enhancement even more clearly. If you found this video helpful, don't forget to like, comment, and share. And for more medical and radiology-related content, subscribe to the channel and stay connected. Thank you so much for watching.